Hello and welcome to this introductory slide deck for our University of Birmingham MSc Advanced Manipulative Physiotherapy and MSc Exercise Sports Medicine Football programs that we have within the School of Sport, Exercise and Rehabilitation Sciences. My name is Michael Mansfield. I'm the current program lead for the Advanced Manipulative Physiotherapy program and a lecturer in musculoskeletal physiotherapy. And my colleague Caroline White is a lecturer in musculoskeletal physiotherapy and the program lead for the MSc Exercise Sports Medicine Football. So the purpose of this presentation is to give prospective students an outline of our exciting courses that we have on our Edgbaston campus at the University of Birmingham in the UK. We'll outline some of the entry requirements, modules, how we deliver some of the teaching, the excellent support and assessment that we deliver in conjunction with our students, and the prospects of employability following the successful completion of these programs. So why us? Why the University of Birmingham? Well, the University of Birmingham was founded in 1900 and was the UK's first civic university. So consequently, the institution has a lengthy history of playing a real strong role in its community, leading the pursuit of knowledge, investigating in impactful initiatives that benefit both the region, but also the national and international direction of travel. Sport is an integral part of life at the University of Birmingham, and it is regularly ranked in the top 5 in the UK for the quality of student support. It was the first UK university to offer a degree in sport and exercise sciences, and today its researchers continue to support the physical activity needs of individuals, communities across the West Midlands region, across the world, and informing new approaches to performance, rehabilitation and health. The university welcomes students across the globe to be part of the global community. More broadly, the university is known for its contributions across disciplines in the medical, life sciences, social sciences, engineering, fundamental sciences and business. And we are very proud that we have 11 Nobel Prize winners that have worked with us here at the University of Birmingham. The University of Birmingham is ranked 90th in the QS World University Rankings in 2022, and we've maintained our position in the top 100 universities globally, and placing us 14th amongst UK universities. So why our programs? Why the Advanced Manipulative Physiotherapy and the Exercise Sports Medicine Football? Well, the QS World University Rankings are the most commonly used global rankings and are a measure of a university's global reputation. The School of Sport, Exercise and Rehabilitation Sciences at the University of Birmingham conducts world-leading research to increase physical activity, optimise health across the lifespan, and our degree programmes cover a wide range of areas from exercise science to sports coaching and allow students to develop and apply their knowledge in the sciences of sport, exercise and health. Furthermore, our research underpins our teaching, of course it does, and investigates topical issues such as the workings of the human body and the ways in which physical activity promotes health and well-being. As an official partner of the Birmingham 2022 Commonwealth Games, the University of Birmingham played a key role in delivering an outstanding international sporting event that focused the eyes of the world on our city, our region and our campus and our world-leading reputation for excellence. So a little bit more detail about the courses now. We'll start with the MSc in Advanced Manipulative Physiotherapy. This program enables exploration of the theoretical basis of manipulative or musculoskeletal physiotherapy and its application to the development of your clinical reasoning in advancing clinical practice. Using the process of a clinical reasoning as its framework, this program integrates many approaches to clinical practice in this specialist area. It facilitates an evaluation of existing research and evidence and your own clinical experiences through the exploration of assessment, management of clinical presentations of musculoskeletal complaints. The program offers part-time and full-time modes of study, with some modules available and supported through distance learning, providing you with the opportunity to tailor your learning experience to meet your own personal and professional needs. Successful completion of this program qualifies you for the eligibility of membership with the Musculoskeletal Association of Chartered Physiotherapists, which is recognised by the International Federation of Orthopaedic Manipulative Physical Therapists, or IFOMT. Our innovative exercise and sports medicine football MSc is aimed at physiotherapists and doctors either working within football medicine or of interest in moving into football medicine. This is a research-led program delivered with a score with 90% of its research classified as world-leading or internationally excellence, with experts from football medicine, sports medicine and musculoskeletal medicine. The overall aim of this program is to enable the exploration of the theoretical basis of exercise and sports medicine in the general and football environments, and in particular the development of physiotherapists and doctors' clinical reasoning. Using this process, clinical reasoning as a framework, the program will integrate the key issues central to practice in the specialist area, including clinical assessment, communication, accurate diagnoses, differential diagnoses, diagnostics and prognostics, treatment interventions, management approaches, best evidence, and evaluation of outcome. So the entry requirements for the AMP program. We expect prospective applicants to have a BSc BA Honours degree in physiotherapy from their home country. Current registration with the Health and Care Professions Council and the Chartered Society of Physiotherapy, which includes professional indemnity, is expected. We are expecting students to provide detail in your application of your experiences of using manipulative and musculoskeletal physiotherapy at a postgraduate level and after any internship that evidences approximately 1,500 hours accrued in a postgraduate environment. And as I say, the internship does not count for this. Supporting evidence of appropriate continuing professional development in a musculoskeletal physiotherapy postgraduate environment is also required, and we will also require documentation of 2 academic or employer references to support your application, professional and practical capabilities, transcripts of your degrees so far, and for those international students an IELTS score of 6.5 with no less than 6.0 in any band. And of course, as this course has a placement component, there will also be a need of a satisfactory disclosure and bar in service check and health declaration and immunisation record. Very similar for the MSc in exercise, sports medicine, football. We expect students to hold a active HCPC or equivalent for medics and doctors and the Chartered Society of Physiotherapy. A BSc, an honours degree or equivalent, and usually this is expected at first or second class. You must also provide details in your application of utilising musculoskeletal medicine or physiotherapy skills in a practice-based setting. Internships do not count in this particular environment. Current registration with the General Medical Council, and similar to the AMP program, disclosure and bar in service, satisfactory checks, health declaration and immunisation record. And also, as part of the application process, we would expect 2 academic or employer references, degree transcripts and an IELTS score of 6.5 with no less than 6.0 in any band. So the admissions process, this is all managed centrally with our central admissions team. We expect students to utilise the portal to upload their application, including their personal statement, degree certification, English language. And then if the criteria is met on paper, we will then invite prospective applicants to interview. This is most likely to be an interview over Zoom. And in the interview, it will be online for approximately 10 to 15 minutes. We will explore the reasons why you want to join the program, your experience and expertise in musculoskeletal and sports medicine, your understanding of research, critical appraisal and the application of research to practice, and of course how you will manage studying a program in the United Kingdom at master's level. The modules within the MSc Advanced Manipulative Physiotherapy are all on our public-facing web pages, but there are a number of compulsory modules, including research methods, innovation in professional development, Advanced Musculoskeletal Physiotherapy 1, which focuses on the assessment and management of the lower quadrant, Musculoskeletal Physiotherapy 2, which is the upper quadrant, Continuing Professional Development and Mental Practice. This is our placement module. And for those enrolled on the AMP Masters, it will be 150 hours of mentored practice, which will be assessed with a new patient and follow-up at the end of the placement. And of course, a research dissertation for the MSc students. This totals 160 credits, which then facilitates students to select one 20-credit module, which is available across our school or college, or perhaps some of our partners in our medical school at the Edgbaston campus. The caveat to this is that placement places have to be available and the modules are running, and we update students of optional modules usually at the start of term with the selection process. For the MSc in Exercise, Sports Medicine, Football, similar, there is a research methods module and dissertation. The Continuing Professional Development and Mental Practice module is slightly different to the AMP programme. This is 100 hours of mental practice, which is then assessed with a portfolio. Sports Medicine Football 1 focus on the integrated assessment and evaluation of a football athlete, focusing on clinical reasoning, clinical skills, and the assessment and evaluation of illness and injury in football. Sports Medicine Football 2. This module focuses on the integrated management and rehabilitation of a football athlete, again incorporating and enhancing clinical reasoning, excellence in clinical skills, and exploring the issues associated with management and rehabilitation of an injury or illness in football. Our teaching and assessments, we're really proud as a institution and as prospective students. You will learn from world-leading experts as well as your peers. As a Birmingham student, you'll be joining the academic elite. We'll have the privilege of working alongside and learning with experts, as I say, as well as your peers. And from the outset, you will be encouraged to become an independent and self-motivated learner. We want you to be challenged, and we will encourage you to think independently for yourself. The programme is delivered via a number of methods across both of our MSCs. This includes distance learning, 2 or 3 day blocks of teaching, and if you decide to take one module per semester, you will also need to be at the university for the duration of that module and any scheduled tutorials, and we utilise tutorials, seminars and practical sessions. You will participate in a range of teaching styles, small group tutorials, presentations, peer group learning and self-study alongside practical hands-on delivery. You will have access to a comprehensive support system that will assess you and encourage you throughout your learning journey, which includes our personal tutors, our welfare tutors, which will help you along your academic and personal items. We do have some financial support for students who are eligible and meet the criteria. Please do check out some of the postgraduate financial support which is available on the public facing web pages. But some flavours and some ideas is there are some scholarships available, both the Birmingham Master Scholarship and the College of Life and Environmental Sciences, and there is also some postgraduate progression awards. The specific details and eligibility criteria can be found on our public-facing web pages. And finally, employability. Physiotherapy graduates typically enter careers or have already been part of the National Health Service or private sector in the UK. They work in hospitals, in the community, as well as sports clubs and the military. And an increasing number of physiotherapy graduates also work in a freelance private practice capacity. Although some students choose to pursue further studies in education, research, or may even undertake further training. What we are proud of is that our students move into advancing or advanced roles in musculoskeletal physiotherapy or in a sporting environment, and this is something that these programs actively support students by the end of successful completion. Thank you so much for engaging and listening with this session. Of course, we welcome any comments, feedback or questions, and I look forward to seeing you in an open day in the not too distant future. Thank you for listening. Bye-bye.